Vitamin B12 is often claimed to be a special supplement that can give you more energy, but there's a lot more to B12 than meets the eye. Not having enough can cause a range of symptoms including feelings of depression, numbness and tingling, and anemia, a decrease in red blood cells that carry oxygen. Depending on who you are, you may be at a higher risk of lower levels, but other people might actually be taking more than they need. I'm Zane, a board-certified primary care doctor, and in this video we'll talk about the signs of vitamin B12 deficiency, who's at risk of getting it, and how people can ensure they get enough B12 for optimal health. At the center of a molecule of vitamin B12 is a single atom of a very specific metal, cobalt, an element originally formed from supernovas. Exploding stars release tons and tons of cobalt, and over billions of years the metal found its way to the Earth's crust, where it was discovered by ancient civilizations like the Chinese and Egyptians, who started using it to color glass and ceramics over 3,000 years ago. Now it's mined alongside copper in Africa for use in jet engines and batteries. That cobalt atom allows B12 to help make DNA that stores our genetic code, the red blood cells that carry oxygen, and the electrical insulation that allows for faster signals through nerve fibers. In nature, B12 is found mostly in animals, so people who follow a vegetarian or vegan diet are more prone to B12 deficiency. Out of all the B vitamins, B12 is the only one that gets stored long term, so deficiency happens when someone hasn't had any in a long time. Knowing what B12 does in the body can help us understand what happens when levels are too low. B12's roles mostly center around nerves and blood cells. In the brain, spinal cord, and rest of the body, vitamin B12 is necessary to protect the insulation around neurons called myelin. When B12 is low, toxic chemicals build up and damage the myelin sheath, causing all kinds of neurological and psychiatric symptoms, including problems with the brain and spinal cord. There's a condition called megaloblastic madness, which is a combination of depression or mania, irritability, paranoia, delusions, and labile moods caused by low B12 in the brain. Each of these symptoms can happen on their own, and so can things like cognitive impairment, dementia, or involuntary movements. On the extreme end, B12 deficiency can cause seizures. Low B12 levels lead to a condition called subacute combined degeneration of the spinal cord, affecting bundles of neurons causing numbness, paresthesias or pins and needles, weakness that's symmetric on both sides, and difficulty walking. In clinic, your doctor might also observe things like lack of coordination and weak reflexes. Low B12 can even make the spinal cord swell. B12 is necessary for the formation of DNA, and when it's low, DNA production and therefore the formation of new cells slows down. This mostly affects red blood cells. This causes megaloblastic macrocytic anemia when the body isn't able to produce enough red blood cells and the ones it makes are enlarged. Those red blood cells are like fake Rolexes. Not only do they not look right, they also aren't as durable, so they break early. And when they break down, they release a pigment that makes the skin yellow and causes jaundice. Other blood cells are affected too, like platelets, the cells that help clot the blood, and white blood cells, the body's infection-fighting cells. In the mouth, B12 deficiency leads to the loss of taste or smell and something called glossitis, which is painful inflammation of the tongue. Having enough B12 is especially important during pregnancy because, along with folic acid, babies in the womb need enough B12 for proper neurologic development, so deficiency can lead to permanent neurological damage. Here are a lot of the complications of B12 deficiency all on one list. So who's actually at risk of B12 deficiency? Well, we can't make B12 naturally, so we need to get it through the diet. It's usually found in animal products, so people like vegetarians and especially vegans are more likely to get deficient. Extra B12 is stored in the liver, but when B12 isn't absorbed in the digestive tract for a long time, eventually the backup storage runs out and people become deficient. Okay, let's take a quiz. How much B12 can your liver actually store? Enough for how much time? 30 days, 6 months, 3 years, or 10 years? If you think you know, pause the video and leave your answer in the comments below. Alright, ready? The answer is C. There's about 3 years worth of B12 stored in the liver, but of course everyone's different, so this is just to get an idea of B12 metabolism. So how do we actually get B12 in the body? Vitamin B12 is trapped inside food and it isn't really digestible until the stomach acid breaks it free. So when there isn't enough acid, there isn't enough free B12 available to be absorbed. We produce less acid as we grow older, so older adults are prone to low B12. Antacids like proton pump inhibitors or H2 blockers are thought to potentially cause lower B12 levels too, along with metformin, a pill used for diabetes and other conditions. Your body absorbs B12 most efficiently with the help of this protein called intrinsic factor. No, it's not the name of an action thriller movie starring Tom Cruise. Intrinsic factor is made in the stomach and helps B12 get absorbed further down in the digestive tract. There's only so much of it available at a time, so once it gets used up, only free B12 is left. And the B12 that's free floating still gets absorbed, but at a much smaller percentage without having intrinsic factor to help it out. The most common cause of B12 deficiency is a disease where intrinsic factor doesn't work correctly, and there often isn't enough stomach acid either. It's called pernicious anemia and affects older people more. Almost 1 in 10 people 65 and up have have it. Pernicious anemia is actually an autoimmune disease where antibodies interfere with the intrinsic factor itself, and other autoimmune diseases might increase the risk of low B12 like celiac disease, type 1 diabetes, and thyroid disease. In people with gastric bypass surgery, the food literally bypasses where intrinsic factor is made, so B12 isn't absorbed as well in people who have had this operation. An infection with a bacteria called H. pylori that also causes heartburn and ulcers also causes low B12. Surgeries that remove parts of the intestines shrink the available area where B12 can be absorbed. Inflammation from certain gastrointestinal conditions interfere with absorption too, also effectively shrinking the area where B12 gets absorbed. People with symptoms suspicious of B12 deficiency should talk to their healthcare provider about getting their levels checked. And people with risk factors for low B12, like the ones I just talked about, should discuss checking their levels regularly with their doctors. One or both of these lab tests, MMA, methylmalonic acid, or homocysteine, can help confirm the diagnosis of B12 deficiency. Fun fact, MMA and homocysteine are the chemicals that build up in the brain when B12 is low and are thought to damage myelin, the nerve's insulation. People who aren't sure if they're having symptoms of a vitamin deficiency, or if they don't know about their personal risk of low vitamin levels or when to get them checked, should definitely consult with their own healthcare provider. As we know, B12 is found mostly in meats, especially lean red meats, chicken, fish, and seafood. It's in the form cobalamin, and it's also in other animal products like dairy and eggs. Nowadays, lots of foods are fortified with B12 like cereals and some nutritional yeasts. Beef liver actually has the most by far, but if you're not a huge fan of liver, here are some other common foods with B12. FYI, the FDA doesn't require food labels to list the vitamin B12 content unless it's actually been added to the food. A higher percentage of the B12 in supplements gets absorbed compared to the B12 in food, and over a quarter of people get B12 through a supplement. And a lot of them eat meat or animal products, so who really needs it? Here's what the recommended daily allowance of B12 is for different groups of people. Other than people on vegetarian and vegan diets, most people with a healthy GI tract can probably get enough B12 through their diet. And since the liver can store B12 for years, most of us don't need to take in B12 every day to maintain normal levels. Out of all the supplements that contain B12, multivitamins generally contain the least amount of B12, which is still way more than the recommended daily allowance. Multivitamins contain at least double the RDA, but some formulations have up to 10 times the daily recommended amount. B-complex vitamins that contain other B vitamins as well have 20 to 200 times the RDA of vitamin B12. And supplements that only contain B12, which we use in certain patients with deficiencies, contain 200 to 400 times the RDA. Under the guidance of a healthcare provider, doses this high are used in certain people like these next few. People with pernicious anemia, gastric bypass surgery, or other issues with absorbing B12 can eat fortified foods and take supplements that contain the vitamin. These forms are usually absorbed well and don't require stomach acid to prepare B12 for absorption. Supplements with high amounts of B12 can get absorbed without intrinsic factors help, and the high dose makes up for the low percentage of absorption. Getting B12 shots, if a doctor recommends them, can help too because they bypass the source of the problem, the gastrointestinal tract. People who don't eat meat may benefit from taking B12 supplements because they're often low in B12 along with other nutrients, and should definitely discuss their nutrition with their own healthcare providers. Some forms of nutritional yeast and other fortified foods like soy milk and breakfast cereals can add to B12 intake too, but pro tip, not all brands of yeast contain B12, so be sure to check the label. People on strict vegan diets who don't consume any animal products probably need B12 supplements and should discuss this with their healthcare provider. And sometimes the seaweed used to make sushi rolls, nori, is promoted as a plant-based source of B12, but it isn't considered a reliable source of B12 because the amounts it contains varies and some forms don't even have any B12 at all. So does B12 offer any mental, cognitive, or energy benefits? B12 deficiency that causes neurological or cognitive symptoms can improve when B12 is replaced, but this can take 6 weeks to 3 months. People with B12 deficiency might feel more energetic after getting more of it back because the vitamin is directly involved in making healthy red blood cells, increasing the amount of oxygen in the blood after a couple of months if anemia is present. But there's not really evidence to show that taking extra B12 can help people who aren't deficient. A lot of that extra B12 that people take doesn't get absorbed anyway. Once the intrinsic factor gets used up, there are significantly diminishing returns with B12 absorption in the intestines. For example, in one report, an intake of 500 micrograms of B12 resulted in 10 micrograms being absorbed, or about 2%. Taking an additional 500 micrograms only resulted in 3 more micrograms being absorbed, which is an absorption rate of 1/3%. Vitamin B12 is a water-soluble vitamin, so anything the body doesn't need gets removed in the urine. There might not be adverse effects from taking too much B12 in healthy people, but people should check with doctors before starting any supplement, especially high-dose ones. When it comes down to it, Vitamin B12 deficiency is not super common, but there are certain types of people who are much more prone to getting it. And because of B12's role in the body, especially when it comes to nerves and red blood cells, low levels of B12 can cause a range of symptoms. Thankfully, low B12 levels are treatable even in people whose bodies don't absorb it well, and a lot of the consequences of deficiency are reversible with treatment. If you've made it to this part of the video, there's a good chance you're interested in getting enough vitamins and minerals in your diet, so check out these videos over here that talk about just that. Peace, see you in the next one.